Good evening, everyone. My name is Gabriele Colosurdo. I'm the Manager of Education and Patient Services at Myeloma Canada. I'd like to thank you all for joining us this evening for our educational webinar series on how to better follow your treatment schedule. As you know, studies have shown that up to 50% of patients have difficulty following their prescribed treatment schedule. And over the past few years, with all the new oral drugs and combination therapies that have been approved and made available for patients, never has it been more important to comply to this treatment schedule. Not complying to your treatment can have negative impacts with your response to treatment, as well as health outcomes and the healthcare system. Our presenter today will be Karen MacCurdy Thompson, who is an oncology pharmacist at the Moncton Hospital in Moncton, New Brunswick. Before I hand the microphone over to her, I'd just like to let you all know that all of our educational webinars are recorded and made available on YouTube, and on our website, myelomacanada.ca. So from YouTube, just go to www.youtube.com, write Myeloma Canada in the search bar, search, and then the first thing you'll see will be Myeloma Canada. You'll click on Myeloma Canada, and it'll take you to our videos. The other way to get there is from our website, myeloma.ca, click on the Resources tab, then click on Myeloma Canada Educational Videos, and you'll get to the same spot on YouTube. Tonight, at the end of the presentation, we'll be taking some questions. To ask your questions, you'll notice on your GoToWebinar panel, you have a little questions panel here. And so if you type your question here and in this area, and press send, I will get them and I will read them to our presenter tonight. So without further ado, I'll pass the microphone on to Karen. We're really pleased to have Karen here with us tonight to discuss how to better follow your treatment schedule.
Good evening, everyone. I'll just make sure the first slide shows. Let me see. Okay, so as Gabriel said, my name is Karen MacCurdy Thompson. I'm a pharmacist at the Moncton Hospital, and I work as an inpatient oncology pharmacist at that institution, but I have worked in the chemotherapy clinic for a number of years prior to that. As we go through the slides tonight, I want you to, if you're having trouble following your treatment schedule, what I'm hoping that you'll see is you'll maybe identify with some of the concerns that I've expressed throughout the presentation tonight. And perhaps once you identify why perhaps you're reluctant or hesitant to take the medication, and maybe you weren't sure why, you just had a reluctance to do so. So maybe you can identify and then you can take action upon what you've discovered about yourself and your treatment plan. Okay. So first of all, we know that adherence is very challenging, and it's challenging for all healthcare professionals as well as the patients. And as providers of healthcare, we take it non-adherence or difficulty in taking medication as a very important concern for us. And statistics are rising over time for the non-adherence problem, perhaps because we have an aging population, perhaps because of the complexity of treatment regimens. And it's estimated that as up to 80% of patients can be non-adherent. And this is just not to chemotherapy medications. This would be to all type of medications. And the statistics that are most often shown is people with high blood pressure, that 50% of patients never take their medications. And you know, this is not something new. You go back as far as 20 years, and there are many publications in pharmacy, nursing, and physician journals on this subject, yet the problem still exists. And it's expected to rise as we have the growing aging population and more oral drugs are put onto the market, especially with oral chemotherapy agents. And really, they're estimating about 30% of all new drugs for cancers, different forms of cancers, are going to be in the oral form. So this is good news in the sense, but it requires a little bit more responsibility on the patient. From Statistics Canada, it suggests that non-adherence leads to about $4 billion in costs, the Canadian government, 5% of Canadian hospital admissions, and 5% of physician visits are a result of non-adherence. And in 2016, there was an article in a journal I like to read. It's called The Oncologist, and it writes, poor adherence to oral antineoplastic therapy was consistently associated with worse disease outcomes, including lower likelihood of response to therapy and higher mortality. Now, most of these reviews, it was quite an extensive publication, were done in breast cancer patients. That's where we have a lot of this adherence information from. But, you know, you can extrapolate it to a certain degree to that of other oral agents for different forms of cancer. I'd like to just go over a few terms before we get down to the nitty-gritty of the presentation. Compliance. We don't really like the word compliance anymore. Hippocrates believed that people faked taking their medication. That was in several publications, so I guess it was a very popular phrase over the period of medication adherence. And initially, the term compliance was used to describe the patient's obedience to the recommendations with their prescribed treatments. But that didn't go over too well because it was kind of paternalistic. And then really clinicians rarely ever think that the patient is non-compliance. And so they only detect about that non-compliance in about 10% of the patients. So the World Health Organization in around 2003 introduced the term adherence, just to change the undertone of this paternalistic viewpoint and to not put the blame so much on the patient. And then there were different writers or authors that described it as the extent to which patients do follow their prescriptions. And then in 2000, Rose and Al said it was a collaboration to achieve mutually derived goals. So really the current definition is it's a treatment adherence, it's a collaborative approach to decision making, ideally with mutual agreement between patient and clinician with respect to medication choice, the dosing and frequency of administration. So it's just not to be all one-sided. The patient should be involved. Compliance was more of a passive role for patients as compared to persistence is the duration of time from starting to stopping your therapy. So you'll hear the terms adherence, compliance, and at one time the two terms adherence and compliance were almost considered equivalent, but we don't really think of that anymore as being so because of this new adherence definition. So why is sticking to your medication treatment schedule important? Well, as we've already mentioned a time or two, that oral neoplastics are receiving tremendous growth in the cancer treatment world, and it is being used first line for a number of treatments these days. And cancer therapies in general have shown to improve outcomes and survival in patients, and certainly a lot of the cancers now are becoming chronic diseases, multiple myeloma probably being considered as one of them. And it reduces the burden of care by allowing for convenient dosing outside the hospital. So this is great. Many groups that I'm familiar with, say, oh, well, if we could take that medicine at home, that would be great, and so it would be. But it also comes with challenges as well as the benefits. Like everything else, there's a good and a bad side. And from the professional point of view, we're concerned about the patient safety and the adverse effects that may occur. Again, another famous quote that was throughout many of the publications, drugs don't work in patients who don't take them. So very true. Adherence is really a multi-step process. It includes the patient to be responsible for filling the prescription, picking it up from the pharmacy, taking the correct medicine at the correct dose in the correct manner. You should be taking it for the prescribed length of time, not overdosing or underdosing, not taking the wrong quantity. not taking it at the wrong time, making sure no doses have been missed, and you've not taken any extra doses. So in other words, it's starting from the beginning to the end. We talk about taking it in the correct manner. Should you take it with food or without food? Sometimes food will affect the absorption, diminish the effect of the drug. Sometimes it will enhance the effect of the drug. Taking it for the prescribed length of time, not only with chemotherapy, but just antibiotics. The doctor tells you to take it for 7 days. After 3 days, your sore throat, your nasal congestion, your sinuses feel better, so you stop taking. Those are all, they tell you to take it for 7 days because that's what you need to do, 7 or 10 days. Because if you stop taking it too early, you could develop resistance to that particular antibiotic, or your infection will just come back maybe even more wild and more vivid than it had originally. Taking doses at the wrong time, I mean, certainly you wouldn't want to take a pill for your blood pressure that makes you urinate a lot overnight. You'd want to take that type of pill in the morning. Likewise, an anti-anxiety agent, you may certainly want to take that at bedtime to help you relax and have a better night's sleep. Doses are missed, you know, most of the time, the occasional one dose isn't so bad, but the ideal world would be it never happened. But the occasional dose once in a blue moon is not so bad. But we really don't know for chemo drugs how much, if you miss one dose or if you miss 10 doses, what the difference is in terms of the outcome. So since we don't know, it's much easier to err on the side of caution and try not to miss anything at all. Any doses at all. Of course, you might hear the term under adherence, taking less medication, or over adherence. You think one pill is good, taking 2 would be even better, which has never been shown to be that way. Now, when I said at the beginning, if you could maybe help identify for yourself some of the reasons why you're perhaps having trouble taking your medication as prescribed or following the treatment plan. And this can be broken down into a few different areas. One is related to the information-related causes of non-adherence. So the patient, this might include that the patient doesn't really understand their disease. Maybe they haven't been informed about their disease. I mean, I hear sometimes, well, the doctor didn't tell me too much, you know, or I really don't understand why I'm taking this medication. So that's part of the reason you don't understand it, and it's not necessarily of your fault. It can be the healthcare team's fault. You're not sure how long you have to take the medication. People just say, well, I'm going to start this treatment for you, but you don't know if it's for 6 months, 3 months, or 6 years. And that's a question I get asked an awful lot by patients. The patient doesn't know how the medicine is to be administered. So is this going to be an oral medication? Is it going to be something I have to take by needle? Is it going to be given to me by intravenous? So again, you're not sure how you will be taking this medication. Understanding the dosing or how to take it. So you take 1 pill twice a day. Does that mean I can take 1 at breakfast and 1 at lunch, or should I take 1 at breakfast and 1 at supper, or 1 at bedtime and breakfast? So again, the dosing regimen has to be clearly defined. Know what to do to reduce and manage the side effects. So if you get diarrhea, do you know how to treat that diarrhea? When does it become a point that you have to go back to the hospital? How long does it exist? Is there something I can buy to help manage that, or what's the seriousness of that? And perhaps you're just shy. I find with cancer patients, they're the group that never wants to bother the physician. Even in our neighborhood for years and years, we only had the one hematologist oncologist. And I mean, patients loved him. He was always late for their appointments, but yet they loved him, and they'd say, oh, well, the doctor is so busy. Yes, doctors are busy, but they really don't mind answering your questions, or it might be a question the nurse or the pharmacist or physiotherapist or dietitian can answer it. Everybody is involved, so don't be afraid to ask your questions. And like I say, sometimes it's just a communication issue. I just want to go back. So how long will the treatment be? I say that's a question I do get asked a fair amount, and I'm reluctant to say because sometimes, honestly, I don't know the full details of the illness, or I'm not quite sure what the doctor has told you. And sometimes it's even hard for the doctor to say. Most of the time when we talk, we give 3 treatments or 6 treatments, but you might only need 2 treatments, or if you don't respond to the first few treatments, or if you had side effects from the first treatment. So it's kind of difficult, but overall, they can kind of give you an idea how long the treatment might be generally. Motivational causes for non-adherence could be something that you're in denial. You don't want to believe that you have this cancer disease now because really it was discovered by accident. You were really feeling good, and just by a lot of times multiple myeloma patients, they've fallen and broken a bone or something like that. We hear that, or they're just going for a routine checkup and the blood work showed malignancies of sort or not within the normal ranges. Maybe you've had a problem with the healthcare team. You really don't trust them. You've had previous encounters, you've had some bad experiences, so you're a little leery of the healthcare team that you're dealing with right now. Perhaps you believe that natural products, you don't want to inject these terrible drugs into your system, that you want to do it the natural way. You don't want to be dependent on drugs, pain medication. I always find cancer patients are the most reluctant not to take pain medication. But there's theory out there that when you have severe cancer pain, it's quite okay to take higher doses of pain medication within reason, and as long as it's being monitored by a pain control specialist. Maybe you don't understand why the benefits of the treatment, why you have to take this, what is it going to do, how is it going to stop the growth of the tumor or growth of the disease, or how is it going to get my blood counts back under control. That can be all explained to you. Maybe you think you won't have any side effects, so you're not even going to listen to the side effects that could possibly occur. And that's when they do occur, you don't know what to do about them. And it is a true possibility that some chemotherapy medications can cause secondary cancers years down the way. That has happened. I've seen that happen the odd time, but certainly for the amount of chemotherapy and the number of patients we treat, secondary cancers is usually few and far between. But you do see that in journals, you do see that advertised on TV. So it is something for you to be concerned of, and certainly ask the doctor or your healthcare team about that. Finally, ability-related causes of non-adherence might just be that the treatment is too complicated. I know with some of the newer drugs that are coming out, if there's 2 oral drugs, one you're going to take for 21 days, one you're going to take for 28 days, and then you've got the IV chemo on certain other days. So maybe it's just too complicated. It needs to be refined, or there needs to be further guidance for you. Maybe the pills are huge. I looked at a regimen today for a lung cancer patient, and my goodness, it was 4 capsules twice a day. Well, these capsules were big, and I admired the lady willpower to take these capsules. Maybe the packaging. We all know everything is tight as anything these days. You might have trouble punching the capsule through the foil, opening the pill bottle. Ask the pharmacy if they can dispense them in an easier format for you so you don't have to fight with the packaging. Perhaps there's just cognitive impairment or a little bit of forgetfulness. Maybe your patient has had a stroke. They have a lot on their mind, so sometimes things need to be rehearsed over and over again. It might not fit into your lifestyle, and there's nothing wrong with that. You want a program or a pattern for taking your medication that fits into your lifestyle. It will make all the difference in the world. So instead of maybe taking a medication 2 or 3 times a day, Maybe there's a drug that you can just take once a day, maybe at breakfast, maybe at bedtime, maybe with your supper, wherever it will fit into your schedule the best way. Perhaps there's a handicap, physical handicap, impairing administration of dose. Perhaps your vision isn't good, so if you had to draw up a dose of a medication in a syringe or in a needle format, you wouldn't be able to do that. Perhaps you have hand shaking, that's that you couldn't hold something steady. So there's a lot of reasons, perhaps. And just overall that the regimen is too complex. And you can see that these are certainly non-intentional reasons for non-adherence. You don't, certain things, perhaps if you've had a stroke or your vision is not well, is beyond your control. So don't be afraid to speak up. Now, barriers, you'll read in the literature, these are pretty consistent throughout the literature, is maybe financial toxicity, or you have no insurance. And as you probably know, all of these oral medications are very costly. And so because of the financial toxicity, you might decide to take less of the medication. You might take it every second day instead of every day, or you might cut the dose in half so that the month supply will last you 2 months. The effects of the illness, you may feel too sick, or you may be too stressed to understand the directions. Symptoms of myeloma, such as your debilitating pain and fatigue, can complicate a patient's ability to adhere to a treatment plan, which makes sense. The complexity of the treatment plan, we've mentioned this a couple times. New agents, if used in combinations, could have different dosing regimens, not only with respect to the dose to be taken, but also the number of times per week that you have to take it, or the number of days per cycle, and this could be hard to follow. So we have some regimens that we use. It's day 1, 8, 15, and 22, but one of the drugs is only on day 1, 8, and 15. So that can get a little confusing. It gets a little confusing for most of us at times. And also, for patients, maybe they have a lot of supportive care medications, and you might say as needed. So don't be afraid to take a medication for nausea if that's when it's prescribed for. Lack of social support, so perhaps you live alone, or perhaps you're the caregiver of your partner, or caregiver of a sick child or mother. So again, don't be afraid to ask for assistance to go into the home to help out. Poor communication is a big problem between healthcare providers and the patients. So don't be afraid to ask questions to fully understand. Medication side effects, again, we'll talk about side effects a little later on in more depth. But maybe you had too much nausea with your very first treatment, so you're not going back for your second treatment. We do hear that. Skipping doses because the patient may feel well, so you're feeling good, so you've kind of forgot that you have to take the pill that day, or you don't have any symptoms, so you think you can stop taking it. Overuse of the medication, again, just like we talked about over adherence, 1 pill is good, 2 is better. So that could be perhaps part of the problem. And difficulty in getting a doctor appointment. And as I was preparing this talk, I got thinking, you see the oncologist gives you the medication, you've learned about the side effects, but who do you go to if you have a side effect, especially if it's on a Saturday and Sunday when your chemo clinic is not open, you just can't pick up the phone and call the doctor's nurse to talk to her about a side effect. So again, you have the clinics, and this is where family physicians perhaps getting more involved in your care would be great. It would be nice if there was some type of arrangement such that if you had a side effect or you had the nausea or the diarrhea, you could call the family physician's office. make an appointment within a few hours, or definitely within 24 hours, to go see them. Perhaps the family physician could tell his receptionist, so-and-so is now getting chemotherapy. If they call with a problem, we need to fit them in within a 12 or a 24-hour time slot. That would be really good. Okay. Oh, I'm having trouble to move down to the next slide. Thank you. So what happens when you don't stick to your medication plan is drug resistance can occur. And drug resistance is just, it's a reduction in how well a drug will work in curing or controlling a disease or condition. I know there's a lot of work in the science world, what causes drugs to be resistant. They don't respond anymore. There's a few theories out there, sometimes a little too in depth for me, but it is a possibility that drugs resistance can occur. So if you're non-adherent, you have a poor response to therapy, which would make sense. You consider the drug to be ineffective. Progression of the disease or poor survival. So if you don't take the prescribed doses as you should, that will certainly have an effect on the disease progression. Maybe if you don't mention to the doctor that you've missed a few doses, the doctor may think that the drug he's using isn't working, and they're going to decide on a treatment change. So that may be totally unnecessary if he knows that you've missed more than the average number of doses due to whatever reason you state to him. It can have increase in side effects, not by taking the medication. So you could have more symptoms of the disease that the doctor's trying to treat. It will result in poor patient satisfaction. So not realizing that if you don't take the medications, they're not going to work for you nearly as well. And this will often lead to increased hospitalization, visits to the doctor, and lab tests, which all results in increased costs to the healthcare system. Also not taking the drugs as prescribed could increase the risk of death due to treatment failure. So adherence myths, I kind of like this idea. I hope you will too. So one myth that is out there is the primary reason is forgetfulness. Well, really, it occurs randomly with only a few slips from time to time. And in studies, it's been shown that only 12% of patients out of 20,000 in a survey said that remembering to take their medication was an obstacle for long-term adherence. So really, forgetfulness isn't the main cause of non-adherence. The second myth would be healthcare workers satisfy patient information needs, which is certainly pertinent to the business that I'm in. Patients complain often that not enough information is provided. Multiple studies have demonstrated that patients receive variable information on the purpose, the frequency, the timing, the dose, and strength of their treatments, and poor information about side effects, risks, costs, efficacy, duration, and barriers to the use of the medication. So in reality, patients want to know the good and the bad and know when to ask for advice during their treatment plan. So yes, people want to know the good and the bad things, not just the good things about their medication. Myth number 3, patients and providers discuss issues about adherence. Not really. Health providers assume patients are adherents, and patients rarely tell their doctor they do not want to take the drug or they take it less frequently than prescribed. Myth number 4, there is a typical non-adherent patient type. And no, that's certainly a myth. Surprisingly, adherence to prescription medications has been proven to be unrelated to a patient's level of self-care and lifestyle. In other words, trained athletes might skip their medication more often than a person who is overweight, has high blood pressure, etc. Myth number 5, making it easier to follow instructions. Various reviews show that simplifying regimens or using calendar reminder packaging only marginally improves adherence to oral therapy. The real issue is how well the treatment fits in with the individual's patient routine, their expectation, and their beliefs. And finally, a common myth is adherence is reduced because of side effects, and a misconception that patients who suffer side effects of a particular treatment are those who are more likely to stop taking the medicine. On the contrary, patients who suffer side effects and report these problems to their healthcare team are most likely to have adjustments made in the dose and/or schedule of their medications. Once these adjustments have been made and the most tolerable and effective dose has been reached, these patients are most likely to adhere to and benefit from long-term therapy. So just a few myths that may be out there, so don't let anybody pull these things as possible myths to you, now that you know the difference. So how can the healthcare provider help you improve adherence? Again, if we would just have more accessibility to the healthcare team, as I mentioned, easier access to family physician, easier access to the nurses at the clinic, more convenient follow-up appointments, accessibility to pharmacists, behavioral specialists, and social workers. So all of that, I know at the Moncton Hospital, our clinic, patients have access, most of these people have access to these healthcare professionals, the 5 days a week from, say, 7:30 in the morning to 5 o'clock at night. But again, that doesn't account for the other 48 hours when they don't have access to patient care. Sometimes patients will call the inpatient unit when they've stumbled upon a problem. And again, there's usually oncology physician on call over the weekend and somebody that goes in to see the patients. So they may be able to help the patient that's not an inpatient. Improved dosing plan, maybe just simplify the schedule, maybe supply some pill boxes or dosettes to help the patient organize. The big thing that we really come up with that seems to improve adherence issues or help the patient follow their treatment schedule is truly educational interventions to increase the understanding of the disease, the risk of the disease, and benefits of treatment and proper use of the education. This is repeated over and over and over in the literature for healthcare team, be it nurses, pharmacists, physicians, to help patients understand the need of their medicine. And then physician initiatives might be just taking time to have the patient involved in the decision making, listening to the patient, learn about the physician to learn about drug costs and insurance coverage, and reinforce adherent behaviors, but not to be threatening in the sense. As I said, we don't have a lot of studies that show if you miss one oral tablet, it will decrease the outcome of your good response to the disease by 20%. We really don't have that knowledge out there, and if we reduce the dose by 20%, it does not necessarily correlate that we're going to reduce the response by 20%. So that's a little scary, and that's why sticking to your treatment plan as best that you can is so important. So what is the patient's role in this overall treatment schedule? So you should not hesitate to contact your doctor or healthcare team if you experience side effects, or if you just need to clarify the treatment schedule. Some questions that you should have answers for and that you should ask is, what happens if I miss a dose? A lot of medicines, be it chemo drugs, be it antibiotics, be it blood pressure pill, if you're supposed to take it twice in the same day at 8 o'clock and 5 o'clock, you forgot to take your 8 o'clock dose, you remember at 3 o'clock, should you take it at 3 o'clock and at 5 o'clock? So what do you do if you miss a dose? What happens if I take too much of the medication? You know, if I did double dose that day. I didn't think I took it, and I did, you know, and then I realized I did take it. So what happens if you take too much of the medication? What are the side effects, and what are the benefits of the treatment? How and when should I take my medication? Do I take it at bedtime? Do I take it with a meal, without a meal? And if you have to take it several times a day, is there something that it could just take once a day dosing for? When should I expect an effect of the medicine? You know, am I going to get an effect with just one dose? Should I start feeling much better? Or am I going to have to take this drug for 2 or 3 months before I see the benefits? How long might you be on the medication? Is this the lifelong medicine, or do I just have to take it for 2 or 3 months or 6 months? And what is the plan for follow-up appointments and monitoring and testing? So, you know, you have a life to meet too. Your disease is one issue of your life, but you still have to maintain perhaps a household, going to work to a certain degree, looking after the family. So how is this going to interfere? Is there a way we can make it simpler? So just some ideas for you to ask, questions you should have answers to. Insurance and cost barriers. We know that the chemotherapy oral medications are very expensive. So maybe before you start treatment, know what type of coverage you have. Do you have a maximum amount to pay? Will your coverage be cut off once you reach $2,000? Or will you only have to, you know, once you reach $2,000, will you have any more to pay? Some plans, that's how they work. And also ask if financial assistance is available. Many of the drug companies and manufacturers of these products have patient assistance programs available to help cover the cost of these medications. Always carry your insurance card with you. I think that's a good idea. I know in our hospital we have a medication assistant, medication funding assistant, and a lot of times she'll just phone me up and she'll say, would you go ask the patient if they have an insurance card or something like that? And a lot of times patients do, but they've left it at home. So try to bring it to your appointments or to your hospital admissions. And again, if the insurance language is too complex, ask for help, someone to either call the company to find out what it exactly means. You know, even my insurance, I call from time to time, you know, if you're going away, or what type of coverage do you have for physiotherapy or your medication or something like that. So there's no harm in asking. Don't feel ashamed or don't feel shy about it. We can try to help clear the way about your insurance as well. The patient role, if the treatment plan is too complicated, don't be shy to tell us. Like I say, where there's a will, there's a way, and we can work with that to make it better for you. Managing side effects. What I like to try to tell patients is keep track of any side effects. So, you know, you might be on cycle 1 or you might be on cycle 2. So when did it start? Did it start 3 days after you had the medicine, or did it start day 7 after you started the medicine? Did it get worse? Did it go away after a few days on its own, or did you have to go to the pharmacy and buy something? Overall, how did you feel, and did you have to go to the hospital? So in between treatments, I like to tell patients if they've had to go to the doctor, if they go to the hospital, if they were started on an antibiotic or a topical cream for a rash or something, just jot that down and let us know when you come in for your next treatment. So we might be able to do something to prevent that side effect from occurring this time around. Discuss the management of these side effects with your healthcare team, and don't sugarcoat what you experienced. I know even ourselves, you know, you maybe take an antibiotic for 7 or so days 2 weeks ago, and so when you go back into the doctor, you kind of forgot to mention it. You're feeling better now, but kind of take notes and jot down, well, this was the side effect, I felt worse. You know, if you're using any type of stimulating factor to keep your white blood counts up, pain. The pain associated with those drugs may only last a day or two, or it might last 5 or 6 days. And did the side effects stay even when the treatment was stopped? Transportation and traveling. Do you have, let us know if you have to hire somebody to drive your car or to take you to an appointment. We service an area, quite a surrounding area. Our patients, some of them have 2 and 3 hour drives, so they might have to pay someone. Can the treatment be given in a smaller town at the hospital there? That's becoming quite common in this province. And many smaller hospitals might be able to do follow-up treatments. For example, say a day 18 or a day 15 if you're taking the drug cortisamine with that. So if you can make a schedule for yourself, put your medicines in a place that's easy to remember, include it in your daily routine. So with morning your best time, supper your best time, or bedtime. Always take a current list of your medications, and not only the name and the strength of the tablet, but the frequency. Are you taking it once a day, twice a day? A lot of people might have gone to the doctor and they're saying, if it's your blood pressure medication, oh, you only have to take 1 a day now, or a half of one twice a day. So, but they might not give you a new prescription. They expect you to remember. So write those notes down. If your pharmacy offers such factors as refill reminders or autofill options, that might be something that you could ask them. And also, of course, as a pharmacist, I think only deal with the one pharmacy. Don't hop all over town because the one pharmacy gets to know you. Don't forget to tell them about your chemotherapy drugs that you're taking. Sometimes there's specialty pharmacies that dispense these medications, but don't forget to tell that to your main pharmacy so we can detect if there's any drugs interfering with one another. Adherence tools, there's such things as pill diaries, treatment calendars. Is that something that would be? Text reminders, smartphone apps, mobile phone alarms, electronic pill bottles, pill boxes for chemotherapy, up-to-date medication lists, and plan ahead for refills. So there's many adherence tools out there, but which one best suits your needs? You may not want an electronic pill bottle beeping in the middle of the afternoon at you, or a mobile phone alarm. Maybe you want to do it the old-fashioned way, just through the pill boxes. There's a lot of pharmacies that will do blister packing for you. However, if I could state that you should never have your chemotherapy drug mixed in with your other pills, the pharmacy should blister pack that separately for you. I don't imagine there would be any problems with your pharmacy to request that. Your multiple day, weekly dosette pill reminders as well, which have been around for a long time. And if you go with the medication apps, I'm not recommending which apps to use, but what I thought I would do for you is what do you want a few issues that if you download an app, stop and think of what do you want this app to do for you, okay? First of all, it's nice if the app is going to be free. We all like free things. Is the app, is it easy to follow? Does it minimal time to download your medications, or do you have to type in each medication? Will it keep track of the missed doses? Will it give you drug interaction warnings? Will it help schedule your appointments? Does it have a database for oncology medications? Because, the app would have to be pretty new to download some of the new oral chemotherapy medications. Pay attention to when it was last updated, and does it interface with another device, perhaps your watch? So again, just to find a little bit of information, read about the app, do a little search about the app before you would download it. I mentioned the word drug interactions on the previous slide, and a drug interaction is a drug-food or a drug-drug interaction with oral agent. So it's a change in the drug's effect on the body when the drug is taken together with a second drug or type of food. A drug-drug interaction can delay, decrease, or enhance absorption of either drug, and this can decrease or increase the action of either or both drugs or cause adverse effects. So in other words, one drug may affect the action of another drug, and a lot of the oral chemotherapy medications can have a lot of drug interactions. So that's something very important. Sometimes you may be on one drug, and if you were prescribed a particular antibiotic, then that can affect your chemo drug, or the chemo drug can affect the action of the antibiotic. So this could result in changes to your medication schedule. You might not have to, you might still be able to take the medication, but you might have to schedule them so many hours apart. Or it might affect the meal schedule, foods that you should avoid. Or it could result in duplication of therapy. So just be careful, and that's why I say dealing with your one pharmacy that has all your medications on file will be able to detect this drug interaction aspect. And if they need to call the doctor, they can certainly do so just at the time of filling the prescription. So I see where our time is getting low. I was going to talk to you about side effects. Fatigue is a very common side effect, and physical activity has been mentioned. Just at this conference I was to, they interviewed a number of people that swore by the fact that physical activity does help to overcome the fatigue. I mean, you can take rests or naps. Save energy by setting priorities. Can you give people other jobs? You don't have to do it all, and a balanced diet is specifically important. Nausea and vomiting. I know our patients always go home with a medication. It says take 1 or 2 tablets every 6 hours if needed for nausea, so don't be afraid to use your anti-nausea medication. Drink plenty of cold, clear liquids slowly. Sometimes just meditation, slow and controlled breathing. Small meals several times a day is okay to do. Spicy foods, fried foods, foods that have unpleasant odors may be best to avoid. And keep a diary to find connections between the certain foods that make you feel sick. And mouth sores, doesn't necessarily have to brush your teeth 3 times a day. 1 or 2 times a day is often enough. Soft toothbrush, mild toothpaste. Keep your mouth and lips moist. Eat foods at room temperature, and avoid alcoholic beverages, tobacco, spicy, acidic, greasy, fried or coarse food that could make the mouth sores more problematic. So to my bring home tips to the group tonight is treatment methods have changed for cancer patients, and the oral medication is certainly more convenient. But it is shifted control and responsibility and new challenges for the patient themselves. Important to stay on a set plan or regimen, or try to adhere as best as you possibly can to your treatment plan. Good communication between healthcare providers and patient. As I said, we maybe assume too much that if you don't speak up that you're having problems. Not everybody will ask you if you're having problems, so some of the responsibility goes back into yourself to tell us you're having problems. Don't be afraid or shy to ask questions. We certainly don't mind. Non-adherence or not sticking to the health care plan is costing taxpayers a lot of money. So try to be stick to your treatment plan, and quality of life. All these medicines that we're given, as you know, there's not cures, there are not many cures for cancer, but we do certainly want you to have a good quality of life. And so when you aren't, you need to tell us how we can help improve that. So I'll sign off for now and wishing everybody the best that we can possibly offer you, and take care. And thank you for your time. Any questions?
Thank you, Karen, for a great presentation. Very informative. I'm sure the audience would agree. Just to remind everyone, to ask questions, use your on the GoToWebinar panel. You have a little tab that says questions. If you type your question in and then press send, I will receive them. So I'm still waiting for some questions to come in. While I wait for some questions to come in, I just want to remind everyone this webinar was recorded. So if you did miss anything, then you can go back to it on our YouTube channel. It'll be probably uploaded, the latest early next week or before the weekend. So you can always go back and look at that and refresh your memory on some of these tips and tricks. The other thing I wanted to mention is, Myeloma Canada, we are working on it's called Myeloma Monitor, and so this is an app that will be available for on your smartphones as well as on your computer, and it'll help you, track your appointments and track your prescriptions and take pictures of any sores you might have, and a bunch of other features that we're currently working on. And so that should be available at the end of the year, probably towards September or October.
Oh, that would really be good, because it's you could download like 5 or 6 apps, and it not being disappointed with each one of them. And what works for one person certainly doesn't work for everybody too. So that would be really good to view and to see and to assess.
Yeah, exactly. And we also have our patient advisory council who is working on it with us. So if there's anything we missed or anything that we haven't thought of, they're there to tell us, and so so that we can at least for the first version, give you the best product available, and then we can always update it in the future.
Yeah, exactly. Great idea.
Sure. So I don't have any questions that came in. So we can wait another minute or two for any questions. I can remind everyone how to ask the questions. I'll go back to the slide there for a second. So to ask questions, you just type in your question here and press send. So another 30 seconds, and if we don't get any other questions, I guess we can end it off here.
And if there's certainly any questions that come after we close off, or you decide to send something to Myeloma Canada as a question, they can always forward the question to me, and I'll do my best to get back to you or get back to Gabriel to answer the question, the best I can with the resources that I have. I certainly wouldn't mind that at all.
Yeah, that's a great idea. So I think we'll do that, because no one has typed anything in yet. So thanks again, Karen, for the great presentation. Thank you for taking the time this evening to do it for us and to inform us on how to better follow treatment schedules. So I wish you a great evening, and I wish the audience a great evening as well.
Okay, no problem. Thank you, and take care, everyone.
Thank you.